Welcome. My name is Dana Slamp. I'm the founder and program director of Prema Yoga Institute. We're an IAYT certified yoga therapy school in New York City. And it's my joy as always to welcome my teacher, Loren Fishman, MD, who is really a pioneer in the applications of yoga with musculoskeletal and neurological conditions. He's a physiatrist and the medical director of Manhattan Physical Medicine and Rehabilitation in New York City. One of the things I adore about Dr. Fishman's journey is after he graduated from Oxford, he traveled to India to study with his yoga teacher, BKS Iyengar, for a year. Since he's been back, which was some years back, he's had an illustrious career, which includes being the author of 12 books. He is now working on his 13th book, which is the second edition of Yoga for Osteoporosis. And he's here today to speak with us about sacroiliac joint derangement. This is part of his upcoming training, Yoga for Back Care. Welcome, Dr. Fishman.
Thank you. Glad to be here. Yeah, I'm going to talk to you about this. I mean, to me, sacroiliac joint fits into a little category. What we're trying to do is to get people to understand and recognize the different causes of low back pain, because the treatments are quite various, even though very often the symptoms seem to be exactly the same. The actual underlying problem that is causing these symptoms has quite a bit of variety in it. And even though the symptoms are just the same, the treatments are different. So that's the important thing to understand. Now we're going to talk about one. This is in musculoskeletal back pain. In other words, there's not anything neurological about it. No pain down the leg, no numbness, no weakness, no funny feelings or paresthesias. This is just a question of something that hurts, and it can hurt quite a bit. The sacrum is the source here, this large bone in the center, and the iliac crests are the joints, are the bones to which there are joints, the sacroiliac joints. It's just as simple as that. The sacrum and the ilium join in a kind of a saddle-shaped arrangement. So X-rays are almost valueless to figure out what's wrong. And MRIs are similarly very limited in their diagnostic insight here. Unless you've been run over by an 18-wheeler and have a sacrum that's shattered in 100 pieces, surgery is out of the question. So the truth is, doctors of osteopathy are better at diagnosing this than MDs because they know more about the bones of the body. PTs are better than MDs, and there's no reason yogis can't be better also. So the question is, how do you recognize it? Well, you notice that these joints are symmetrical. And if one of them gets out of kilter, suppose one of them gets pushed forward, the sacrum is pushed forward in this one, well, then it's going to be pushed backward on this side. Oops. So people might say to you, you might think I'm crazy, but this pain goes from the right to the left and then back to the right, and then it seems to vary. Well, that's typical of sacroiliac joint derangement. And you can ask them, well, when does it hurt? Sitting, standing, walking, lying down, or getting up from sitting, getting out of the back seat of a taxi? That's sacroiliac joint derangement. And of course, you want to rule things out. Do you have any pain down your leg? No. Do you have any funny feelings, numbness, anything like that? No. Any weakness? No. So then you think you're on the right track. And there are a couple of tests for it too. One test is Genslin's sign, where someone lies down on a bed. It's an old Swedish sign, and has one leg off the bed. And then you take that one leg and keep the knee straight and bring it down. And then if there's sacroiliac joint derangement, it'll hurt right there in the sacrum. It's about 60% accurate. It's not a great test, but it's better than the others. The other thing you can do is put your thumbs on the posterior superior iliac spine, which if the person were turned around would be right about there in the back. And then you ask them to bend forward. And if those joints move asymmetrically, one comes up and the other goes down, or the other goes up and the first one goes down, then that's another really good indication. A third one, I think I can show you right here. You stand there, you stand on a yoga block with this leg, and then you lower this leg, you lower it down. So you see my sacroiliac joint is moving. if that hurts, that's also a very good sign. Then you make them do it on the other side, of course. So that's how you can recognize if it's there. So let's go on and look at it a little bit. What does it do? Well, it connects the spine to the pelvis. That's what it does. This spade-shaped bone kind of digs into the iliac crests. Sacral flexion, it doesn't move, as I might have been suggesting before, that this side comes forward and this side comes back. It moves on the diagonal like this. So if this side comes forward, then this side will go back. And if this side goes forward, then this side will go back. It's on the bias. It's got an axis like the planet Earth. That's what there is to say about it. All the discs lie above it. And then there's a little bone below it called the coccyx, which is a sort of rudimentary tail. Once upon a time, our ancestors had tails. So the movement itself is limited, but critical. You know, if you look at the upper body as being devoted to movement, flexibility, capacity, swiveling and twisting and bending and turning, then the lower body has to be looked at like flying buttresses. It's the support, the solid part of the body. And the sacroiliac joint negotiates between the flexibility and mobility above and the stability below. It's sort of like the universal joint on an old car. It negotiates between stability and flexibility. So it's got a hard job, and it doesn't move all that much, but it does move. And it gets inflamed, as the redness over here suggests. So I said some of these, but getting out of a taxi is what hurts. Iliac crest pain right up here. Lumbosacral pain, which is right around there. Buttock pain you can have, but not that much. Hip, groin, pain on stairs, going up or going down. What are the causes? What brings it about? What incident got you to have this kind of pain in the first place? Well, reaching and lifting is a good one. Like there's a computer across the desk and you reach over and pick this heavy thing up. Can give you a herniated disc. It's true. Could also give you a sacroiliac joint derangement, particularly if you're twisted. You can step in a pothole and that'll do it. Of course, trauma can do it, being back-ended in a car. In pregnancy, the placenta gives off a hormone called relaxin. And as the name suggests, it relaxes all the ligaments. If you think about the sacroiliac joint, it's almost a vertical joint. So what keeps it from slipping through there? Well, gravity and some tensile strengths, but also ligaments. And in pregnancy, those ligaments get weaker. They get more flexible. Why? So that this little one over here can stretch and let the baby come out. But it also lays you open to sacroiliac joint derangement. Also, the fact that women have a 20, 30 pounds out in front of them, that they walk differently, that they can't lie on their backs a lot of the time. All these things make a pregnant woman kind of a perfect victim for sacroiliac joint derangement. And they can't take medicines, and they certainly can't have surgery. So what's the best treatment? Well, yoga fits in very well, doesn't it? So we just talked about this. Leg length discrepancy is a noted cause. I don't see it that often, but people sure talk about it. So the physical exam, we talked about this forward bending where the posterior superior iliac spines are moving asymmetrically. Genslen sign where you're lying on the table and you bring the leg down and it'll hurt. And leg off the step, which we just talked about, leg off the yoga block. Positive response, what happens with the forward bending? You get an asymmetrical movement. What happens with Genslen sign? Well, you get pain. This one where the leg goes down. And leg off the step, asymmetry and pain. One side hurts, the other side doesn't hurt. So that's how you can figure it out. You don't have to be an MD specialist to figure this out. And what is the yoga for? How do you help them? Well, I ask people to go into a warm bath, not hot, not cold, no Epsom salt, just a bath. Our specific gravity is almost the same as that of water. So if you lie in a bathtub, submerged up to your jawbone like a crocodile for 10 minutes, the joint may adjust itself because it's in a medium of its own constituency. It's like, it's free. Then there's Virasana, the hero pose, where you're turning your thighs inward. And in doing that, you open the sacrum up. I mean, look, if the legs come forward, then you can see I would open up the iliac bones and give the sacroiliac joint a little more play, a little room to move. Then Gomukhasana, the cow pose, where your legs are also brought together. One knee is right over the other. That brings the thighs together, which opens the bones behind. Garudasana, the eagle, does the same thing. And then the peacock, which it's not really the peacock. It's a distant second cousin once removed from the peacock. What you do, let me bring this back a little bit. I'm not going to be able to do it here because the table I'm on isn't perfect for it. You take your elbows and dig them into your ribs. Take the heels of your hands, put them on the table, and then you lean forward to transfer weight off of your feet and onto your elbows, which goes to your ribs, which goes to your spine, and kind of lifts the whole spine off of the pelvis. So once again, the joint is free to reestablish, re-equilibrate itself. Now, I'm going to teach everybody how to do that in the course. I'm not going to teach you right now. It's not as easy as it sounds because you have to relax your abdomen. If you don't relax your abdominal muscles will hold the pelvis and the ribs together and you won't get the effect you're going for. So how common is it? It's pretty common. And it is very poorly treated by the medical community. And there's every reason to think that yogis can take this over. In my practice, the yogis do it all the time. Okay, so Dana, I think that's just about all I was going to say. I'll show you where it fits in. Here's the neurological causes, herniated disc and spinal stenosis. Here are the musculoskeletal causes, tight quadratus lumborum muscles, tight hamstrings, facet joints that are out of kilter, and sacroiliac joint derangement, which is what we've just been talking about. Then there are the mixed ones, like piriformis syndrome, where there's a muscle, so it's musculoskeletal, but the muscle is entrapping a nerve, so it's neurological too. Spondylolisthesis, where it's a bone slid forward, and again, that involves a nerve very quickly. And arthritis, which is clearly a condition of bones, but nevertheless, sometimes those bones get so swollen that they begin to impinge on the course of a nerve.
Thank you, Dr. Fishman. Since I'm here and getting use of this lecture too, this class, I have a follow-up question for you. You told us what we can do for a sacroiliac joint dysfunction. Is there anything in the yoga practice that you would advise against? Yeah,
there are the number of things. I think bending backwards, doing back bends, Rajkapotasana, Urdhva Dhanurasana, even so far as Uttanapadasana. That one you might be able to get away with because it's not very much of an arch, but many of the bigger back bends seem to take the sacroiliac joint forward relative to L5. So here's the sacrum and it's slipping up and down. That seems to be a pretty good contraindication. Sometimes twisting poses can hurt a great deal too, because the pressure is on one side rather than the other. It's a good way to learn if it's sacroiliac joint derangement because you'll note great pain. I'd use it more in a way that yogis have always done, but that I think American medical legal experts would say, don't use these words. I'm going to use them anyway. They're helpful for diagnosing what the pain is caused by. So yoga is not only a good treatment, it's a good way of figuring out what's wrong. So those are the ones I'd be loath to give you. Also ones where the legs spread apart, konasana, baddha konasana. Because remember we were saying if the legs come together, it opens the sacrum. Well, in that case, what does bringing the legs apart do? It closes them.
Thank you, Dr. Fishman. And if someone were experiencing pain from sacroiliac joint dysfunction, they know that, they've been to their doctor, they've received a diagnosis, will the sensation tell them when it's appropriate to start doing yoga such that is at the point of diagnosis contraindicated, the things you just mentioned, deep back bends?
Mm-hmm. How will they know when to go back into the things that are forbidden?
If ever?
Yeah, they usually can. The half-life of the connective tissue that joins the sacrum here to the ilium is about 6 months. It's not that fast. So this pain can be pretty severe and pretty disabling. People get out of, they eat dinner and they get out of the chair and they walk as though they're 100 years old because it's so painful. So people are skittish about returning to anything that might endanger recurrence. I would say in general, your tissue is half replicated in 6 months. It's half replaced in 6 months. So sometimes 3 months is enough. I would say the main recommendation here is an abundance of caution. When they're going to do the twists, let them first twist like this, then let them twist like this, then like this, then like this. Let it go.
Right.
Take a couple of weeks to rejoin your old regimen.
Right. Don't touch the boo-boo, as they say.
If you get to the pain, don't work through the pain. Let the pain deter you and come back in another couple of weeks.
That's such good advice. It's good to know what we can do. And I know it's general. You're not seeing the listeners, the students of this as a patient. This is just general thoughts. But it's good to know that there's something we can do in our practice that's helpful, and also what to back away from for a period of 3 to 6 months, most likely, general advice, and to use an abundance of caution. And what I'm also hearing you say is the classic yoga advice: listen to your body. If it feels painful, stop. You can breathe in it. Yeah, don't do it if you can't breathe in it.
Listen to your client's body. You can overhear the crosstalk between the patient and his or her body. You can overhear that yourself and figure things out. Like if they're starting to grimace, don't be afraid to ask them why. What's happening? And then what should you also talk about? What should you avoid when you do this pose? How can you keep people from getting sacroiliac joint derangement? The answer is you can't stop them completely, but you can, at least in your own practice and what you're teaching, do things that are safe for them. And that involves the poses that put a great strain on one side of the pelvis are poses that you should be very careful with them about. For example, if you're going to teach them, let's say, Warrior 3. You're going to teach them Warrior. I don't know if you can see me or not.
I think I can see you enough to see your Warrior 3. Let's give it a try.
I'm going to do Warrior 3 here. And when I do it, if I were just learning it, I'd say, put your hands here. And then work so that your leg comes up. And then raise your arms out.
Right. So teach in steps or kramas.
So that, because there's tremendous stress on part of the sacroiliac joint. In twists, don't encourage them to go for the swing for the fences, Let them do it with a certain circumspection. What else? The standing poses, Parivrita Trikonasana, the revolved triangle, Parivrita Parsvakonasana, the revolved side angle pose. Let them be careful there. Those are the kinds of places where there's asymmetrical pressure on exactly these helpless joints.
Amazing. I think going slowly and being mindful, and perhaps not sequencing, for those types of yoga, those lineages that have flows, watching our sequencing and not having a bunch of one-legged balances in a row,
exactly.
But coming back to symmetry.
And the most important thing, I think, is to know your enemy, know your friend. In other words, someone who doesn't have good coordination, who's shaky and jumpy and not secure, don't take them places where they should not go. Don't be afraid to say, okay, class, we're all going to do the twisted triangle. But Martha and John, you guys do shoulder stand. Don't be afraid.
Thank you. Be person-based in your teaching.
Yeah.
Well said. Okay. Well, Dr. Fishman, thank you so much. I know that you have abundance of knowledge to share with us. If you wouldn't mind stopping sharing your screen on your end.
No, I don't know.
Then there you are. There you are. So we look forward to seeing you live on Zoom, September 14th through 18th. I know that there's students here, and this is in 2022, and there might be students here all over Europe or in the UK who would like to take this course and can't make all the hours. Here at Prema Yoga Institute, we do have a fairly generous absentee policy where if it's 5 o'clock where you're at, you can always watch the recording later. And we'll also be offering this on demand if you've run across this short class in sacroiliac joint derangement and you'd love to take the larger course of yoga for low back pain. This will be offered on demand at our website, premayogainstitute.com. In the future, after we get to study with you live, Dr. Fishman, thanks again, and I'm looking forward to
Pleasure.
September.
Okay, me too. Bye.
Goodbye.